HHS, or our center, but it's really a culmination of what we hear from the people who are doing the work, and really allow you all to express on this platform an opportunity to express what is working really well with your communities and what can be improved upon, what you need help with. And so, as I shared with some of you in previous sessions, we are gathered virtually today, but take time to acknowledge the land and pay respect to our indigenous homelands that were forcibly taken over and inhabited, past and present. We want to honor the land itself and the people who have stewarded it throughout the generations. This calls all of us to forever learn how to be better stewards of these lands through our action, through our advocacy, our support, and our education. We acknowledge the painful history that our people have experienced for generations, and to know that we pay respect to the many diverse indigenous people connected to this land on which we gather from time immemorial. While injustices are still being committed against our people on Turtle Island, today we say thank you to those that stand with indigenous peoples and acknowledge that land itself, the land reparations must be made to allow for healing for our people and to Mother Earth herself. And this document was written by 3 of my colleagues, Ella Driscoll, Keely Driscoll, and Sean Bear. If you look at this map here, you'll see that it shows where our university is located in the yellow center of the map. There's about 4 states in yellow. We are located at the University of Iowa. And the reason why we use a land acknowledgement specific to the Meskwaki area is because our university is housed very near that community. And so we want to pay homage and recognize that as a university. However, it's important to know that although we are housed there in the center of the country, that's where our main office is. We have the honor to serve the lower 48 and Alaska communities. There are regional communities that might serve you more closely, might work with you more closely in the work directly with your communities, but we also have that opportunity because we only serve Native communities across the country. After today's event, I'll ask for some feedback from each of you. A GPRA, it's a government performance review assessment. So it's really important that we get some feedback of what's important to you for this platform and what you might have needs for in the future. And then any requested resources that you may have from our center for prevention programming. It is really important that we support the work that you do, because we know it's important work that you're supporting your own communities with. And sometimes you do that on a very limited budget. And so we want to provide you with that extra support whenever we can. I think it's important that we learn a little bit about who's with us on the screen. Some of you were able to share earlier, but just so you know that this is an opportunity for you to come in, support each other, talk about your good work, talk about what's going on in your programming and how we might be able to support you in future programming. We've been hosting these platforms for the PFS grantees to share your stories, share what's going on and what's working really well. And so I was not a part of the original surveys that took place with tribal communities a few years back. I was serving at our center, but in a different capacity in the K-12 program originally. And so I've only been serving in this specific role for about 1.5 years with the prevention office. And since that time, I was asked to see what is going on with our PFS grantees, find out what is working, what are their needs, and how can we support them. So I come to you as a representative of our center, the National American Indian Alaska Native Prevention Technology Transfer Center. I'm Dr. Allison Bays, and I serve as a program manager, but I'm just one part of our team. And so there are many folks on our team who can also assist in different areas for mental health, addiction, trauma, and K-12 mental health. So I'd like to learn about who's on the line with us today. If you want to unmute yourselves, share a little bit about yourself, where you're from, and what role you serve in your community.
Okay, I'll go. My name is April Marshall. I work for the Native American Health Center here in San Francisco. I'm a program coordinator too. And currently, like I was saying earlier, we have a lot going on. We have different agencies that we collaborate with, the Cultural Center, Indian Education, Friendship House Association of American Indians. And so we're doing a lot and we're putting ourselves out there. But currently, we started our Young Women's Youth Singing Group, cultural group, and we've met 3 times so far, where we teach them to sing, and they learn about their tribal languages and support them any way they can. And we meet twice a week, and we will be going to, we invited them Sunday, I think it's, I'm not sure if you're familiar with Fawnwood. We'll be singing in San Francisco. So we told them that that would be a good place for them to see her singing, because we sing some of her songs, cultural songs. So it just started back up, but it's so far, last year was a great success. And I think this will be a great success, our second time around for this program. And so currently, we also participate with, like I said, with other agencies, with the youth doing GONAS. And but right now, all the other agencies are kind of out and everybody's busy doing their thing. You know, a lot of camping and stuff going on currently.
Thank you, April. Shamasina or Michael, who'd like to go next?
I can go next. I'm Michael Karosky. I'm the project manager at Cook Inlet Tribal Council here in Anchorage, Alaska. And this is our second PFS grant. We originally had a SPIF-TIG grant, started in 2008. Then we got a PFS grant, and this is our second one. And all of that work has been focusing on pretty far upstream, what we call upstream, more resiliency work. And primarily working with the adults who affect kids. We started with working with teachers originally, and did a massive effort in Anchorage School District, working with teachers, trying to help them enhance their skills and be able to work with all different kinds of kids, based on the research saying that kids, schools are a primary inoculating factor for kids, especially kids that are high risk. Second to families, schools are the most potent as far as inoculation for drugs and alcohol and all the other risk behaviors. So we spent a lot of time on that. And then with the first PF grant, we targeted a middle school that had the most Native kids in it, and really helped that whole faculty begin to work together as a team, and had some tremendous success. And then this year with this grant, this PFS grant, we're working with the Native charter school. And since it's a smaller grant, we've just worked with one school, and it's a K-8 school, which and they have lots of trauma, lots of some really severe issues and challenges. So we worked a lot with training the faculty, again, working with the adults who work with the kids, faculty and staff. What can they do? How can they get aware of their own trauma? What can they do? How can they help kids with their trauma? What they be aware of that? How they come across? What kind of community they create in the classroom? What are the procedures and efforts they can do to build community, help kids feel safe in the classroom, and respond to their social emotional needs as well as their academic needs. All of that is this current 5-year project. And we're doing that through the Anchorage Youth Development Coalition. We can't really fund the school directly, so we give the grant to the Anchorage Youth Development Coalition, which is a local coalition of 60 youth serving agencies in the city. And they're the ones that are providing the direct services to the faculty and staff and coordinating all that. So it's a nice way of helping a local agency get more capacity to do this work after the grant is over. So it's going well. We've got our early evaluation data coming in, and of course the faculty just love time to be able to talk and get to know each other, to just have the day off to go do that, and they get paid for their coming in and doing that. And so they've had a lot of time to build community among themselves and get open with each other. It's going pretty well. It's going very well, actually. So that's a quick summary, maybe a little longer than quick, but anyway, that's kind of our perspective and our efforts and kind of what we're doing right now. So I'll stop there. Thank you.
Thank you, Michael, and thank you for joining us. I know for a few months you've been trying to hop on and you've always had some kind of conflict or another, but I appreciate you taking the time today and for sharing. Jamasina, are you able to hear us? Are you in the area?
Yeah, I'm
Okay.
here. My name's Jamasina Webster. I'm the program director of the Substance Abuse Prevention for Society Care with the Santee Sioux Nation. I am from the Northern Arapaho tribe, but I have some Santee in my ancestral family tree. We've been what we've been working on, especially with the past 3 years or so, is we had a talking circle. It started with the Santee Community Schools, and it has expanded to serve more youth to the Niobrara Public School, which is I'd say about 15 miles away, in efforts to serve more Native youth in the area. The talking circle is really essential for the youth, especially with you have seasonal. Yeah, I have my daughter here. With seasonal, it brings up hard times, and it's helps them remember how their ancestors have taken on those hardships, especially with the Dakota 38. We take time out of the year to remember that and go over the stories. Sometime this year, we plan on taking a trip to Minnesota to visit those sites and talk about the history. And within the program itself too, we go over culture and all types of stuff. And it functions as a youth council too. And they have attended Unity for the past 3 years. And this year we brought 11. And the first year we started with just taking 5. And another thing that we have planned, especially aside from the talking circle, is a drumstick making class. It's supposed to set place on the 27th, and it's going to be instructed by Jeremiah Flowers, a local. But due to some occurrences in the community, we're going to cancel just out of respects for the families. So we're going to schedule for next week. As for planning in the future, I'm looking to possibly a hand game tournament for the youth councils in Nebraska as an invitational, so they can come together and talk about their successes, to help inspire each other and exchange ideas for fundraising so they can be self-sufficient. I'm not too sure if I'm gonna oh yeah, and last year we did the Red Ribbon Week, and 3 local speakers were to come and talk about how their road to recovery from addiction in front of the school. And it was really good for the youth because these are people in their community, not people that they haven't heard of or they're not from the area. They see them possibly on a weekly basis or at least once a month. It was really nice. It was a good turnout. There was a coloring contest to involve the pre-K and elementary. So the winners of that contest, their poster is going to go on a billboard. So that billboard's being finalized. I was waiting for a translator to do a message in Dakota, but just due to time, we're going to go forward without. But this year, I'm working on reaching out to our partners in Nebraska on expanding the Red Ribbon Week and getting their ideas on how they see how this can be successful in their communities. But I guess that's pretty much it.
Sounds like a lot of good programming is going on with your group. And where exactly are you located again?
Santee, Nebraska.
Okay. Because I heard you are Northern Arapaho yourself, but you work in Nebraska, right? Okay. I had a wonderful opportunity to go serve with the Arapaho community in Wyoming just a few weeks ago. And we had a nice little tour around there. So I appreciate you pushing yourself and challenging yourself to be away from your community, but still serve your community in a different sense. It's very rewarding work, as challenging as it is. All three of you for taking time to be here and share a little bit about your story and where you're at and who you work with. We appreciate that. I'm going to put a few more things here on the slide screen for everybody. Just so that everybody understands where we've been these last several months. And if you look at the last 9 months or so, we've been trying to meet on a monthly basis, give or take, but these have been the dates for the previous meetings. And we spend about an hour of our time together, just listening to your stories, listening to what is working really well, what concerns you may have in the area of prevention, what challenges you might find, and what you are learning from to do better and different the next time around. And like, for example, Jamasina, you mentioned your Red Ribbon Week. You're already thinking about what you're going to do different for the next time. And I think that's great to always be mindful of how can we improve upon the work that we're currently doing. And just so you know, our K through 12 program at our center has some great resources for Red Ribbon Week online. And I'd be happy to share that with you. Anybody else, you can go to our website and find these items out. But for the last several months, these are the 4 key topics that we've been speaking about. As I mentioned, we've had roughly about 50 people, I think it's like 48 folks who have joined off and on from time to time out of the original 95 people who were invited last summer to join us in the forum. So about half of them have shown up, half of you have shown up to come and talk about the important work that you're doing. And one of the key things that I thought was important that has been brought up several times, and I know is very successful in the field of prevention, is going back to traditions and ceremonies. Because we know our culture is prevention. Our culture gives that connection to our children. And so it's really important for us to be able to have that connection and support it. Even when we're not with our own communities. Jamasina, I had that same experience personally because I am from South Texas. My tribal community is here, the Tapilam Quawitakan Nation, yet I reside in Minnesota. And so ceremonies are a little bit different there. We've attended a few, my husband and I, and it's not the same. And we're not with our family, but we step out of our comfort zone to join other tribal communities and go back to tradition, go back to ceremony when we're there. You all already started the conversation starter, giving us an idea of who you are, what region you're in, what area you work in, and the tribal communities that you're serving. So I want to say thank you for that. I also see there's a question in the chat. Okay, or a comment rather. So I will send you those things. But some ideas I'd like to process with you today, because it's my understanding, although Michael, you shared that this is your second PFS grant. Some of you may be bringing this grant to a close for this year already. If you are in that process, what is having the grant meant for your community? Michael, you shared like having this opportunity to provide funding to this organization to give them that capacity that they need for extended services is amazing, because we know that when we look at our communities, we don't always have the funds to provide that. We're scrambling in many ways to provide those services. So I think that's amazing that you've been able to provide that support. Is there any other, are there any other ways that you know the PFS grant has impacted your community in a positive way? Anybody?
I just want to say, yeah, we had the last speaker, Jasmina, Yeah, we had also a hand game turn, not hand game demonstration is what it was, since we're in an urban area with the community, with the youth, because that is part of handing down traditions and culture, and that the majority of tribes here in the United States have played stick game, hand game of some sort. And so that is part of our culture before, you know, and so we thought that would be a good thing to demonstrate and have someone come in. And so we had our guests come in and they demonstrated, and the connection with our community was unbelievable and overwhelming, along with the youth. It was just, it solidified us that we have, although we were different tribes and from different nations, it shows that we connected for that. And it was a great feeling. So I just want to put that out there. And then we also did the, with youth and the community belt making, you know, and we did bell making. And so those are some of the things that we've been doing also, you know, just to connect our community along to our youth so that we can bring them all back together. But I like the idea, like you were saying, handing down those traditions is very, very important, because that's who we are and that's part of our identity, you know, as a people, as nations of people, you know, that once we're taken from us, and to bring those back is really, really important.
I put the question in the chat, so if anybody wants to respond to that in addition, please do so by unmuting yourself.
I can talk a little bit about that. I think one of the benefits has been that through the Cook-Inlet Tribal Council effort, through the 3 grants that we've had, the whole idea that the adults can make a big difference in kids' lives, the teachers in particular, or the youth serving agency adults. You know, that a lot of times we get hung up on, if we got to fix the parents, because if the parents aren't working well or doing well with the kids, then there's nothing we can do. Well, there's lots we can do, and helping the other adults in kids' lives know what to do, know how to be there for them, see themselves as resources, have the skills to do that, can really make up or override some of the stuff that's going on in the home that we can never change. So this whole concept of other caring adults is a very powerful thing, and our whole effort has been doing that. And so the whole community now has this idea that, and even, you know, youth serving workers, youth serving agency workers see themselves as this. I'm a person that has some power in this kid's life, and inoculate them. So that whole shift of mentality of the adults having some potency to be a resource for young people in their lives. And the other really practical thing was we piloted this intervention with the faculty at one middle school with our PFS grant. It was really a pilot. We went to the school that had the highest Native kids in school, the middle school. Spent 4 years working with the faculty, building a community with the faculty. The faculty knew what to do with the kids. The data was so conclusive. Their grades went up so much, their behavioral problems went down so much. The district found money to implement that program across all the other middle schools in the district, which is a massive intervention when you think about it. And in hard times when the district's, you know, cutting back on things, they actually found money to implement this across all middle schools. So that was a huge intervention for us, and very proud of that we were able to pilot something that really was so effective that the district bought it, which is pretty rare. And the final thing is just this idea that if teachers build a community in their classroom, one of the best ways they can do this is start each day with essentially a talking circle. I mean, we don't call it that, but, you know, in our Native traditions, that's what we call it. We call it a talking circle or a heart circle. And that's a primary way. And so we have that done in many of our schools now. It's middle schools that we piloted now with this, with our Native charter school. Every day, every teacher starts their classroom with the talking circle. And that brings the community in, reinforces the community of the kids among themselves, helps the relationships. It's all about connections and relationships with our, again, very core Native values for us. So those are some real practical ways that we're seeing the work that we're doing make some changes. So thank you.
Yeah, I think that's key, to engage all of the adults and let them know their value and their worth and the place that they have in our children's life is important. And in the same token, to support them in the work they do can be very challenging. I'm an educator by trade. I've taught anywhere from middle school to high school to higher ed, and there's a lot of turnover in the school system, especially since pandemic. And it's been tough for a lot of educators to keep doing what they've been doing because of the signs of the times, if you will. And so to support educators is really important, and to know their value. I thank you for sharing that, because sometimes they're a forgotten population. Sometimes they're not valued for what they bring to our children's lives and the impact that they have. So thank you for sharing that.
Well, what we found too is the more teachers feel like they're acknowledged and they're recognized and valued, and they build a community among themselves as a faculty, the less absenteeism, the less calling in sick, the less they move and change locations. So there's selfishly, that's really good for a school, that if they can retain the same teachers over time. And doing this work has really shown us that goes a long way to helping teachers want to stay in a place that's doing this kind of work.
It's wonderful. Thank y'all for sharing. Anything else that you'd like to add for our first question before I move ahead? Now, the last time we met, some folks shared. Oops. Thank you for sharing. I think I had myself on mute. The last time we met, some people were saying that they were in their final year of the grant and had just recently applied for the next series or the next award years. And so my question to you all is, if you're in that position, what additional plans, what future plans do you have for the next run? If you could keep your programs going, what are you planning to do for programming, supporting our youth in the field of prevention? Any ideas of what you're hoping to accomplish? Is everybody finishing their last year of the grant?
We have one more year.
Okay.
Yeah, we'll be done next October or end of next September. So we have one more year. So we haven't got that far yet.
Okay.
I think we have one more year also.
Okay.
Us too. I think we have one more year.
Okay. That's good to hear then. We're always welcome to process with each other and support each other in ideas and suggestions for what's been working, what you're going to implement for the next year. So here's our final question for today. Looking ahead, because next month in August, we'll have our final conversation on Tribal PFS. It'll be our last session that we have formally provided for everybody. How would you like to remain engaged with our center? How would you like the Native Center for Behavioral Health, NCBH, to support you in the work that you're doing? Is there something specific that you'd like to carry on a conversation with us after today or after next month to see how we can support your work?
I have an idea. In thinking about maybe applying for another 5 years after next year, it would be really helpful to know what the research is saying. Are there practices that have been documented that are culturally respectful or culturally based, that are effective, that actually make a difference, that we could look at replicating or implementing or whatever you want to call that? But what does the research say about Native cultural practices that work? Are there things that have been documented that really do make a difference?
No, I think that's really great that you shared that. I was at the CADCA conference back in January, early February of this year, and I was looking for prevention programs for our Native youth. And I walked around. We had a booth just to inform people about our center and the work that we do. But I was looking for resources, because we're very supportive of resources that have been proven to be effective, like you said, with our Native communities, because there are a lot of great resources out there and they're evidence-based, they're tried and true, but they come from a Western perspective. which is not us. So I always want to see what is out there that is directed towards our people. And I found one program for, and I can't remember the title of it, Venture, I want to say is what it is. I have to confirm. I'll look it up and put it in the chat. But it's an outdoorsy kind of program where you encourage children to go out and learn, for lack of a better word, like camping skills, things, how to cook, how to, go on hikes and find traditional plants, and how to be self-sufficient outdoors, going back to our tradition. And you make it very specific to your community, because what is good and healthy for us to eat in South Texas out there that is native to our ground here is not the same as what I'm going to find in Minnesota or Alaska or anywhere else. So regionally, we need to be prepared of how to help our young people learn these skills. And it's a really good program. And I found it to be very useful. I know of the Wichita tribe in Oklahoma has implemented it this year, and they've had some real hit and miss with it, because some of the kids don't want to be outdoors doing tasks and working outside or learning to be outside. But they're still pushing forward with it. And they're going to give it, a year to two to see how that works with their community. Julia Russ, who's usually on the call with us for PFS, she's up in the Sacramento area with her tribal community. And she says they've been using it there for a while and has been successful. But Michael, you bring up a very good question, because so much of what we have to utilize and have been asked to utilize and implement in our centers and our programs are evidence-based practices from a different tradition with a lowercase t, if you will. But I want us to be more mindful and look at things with a capital T from our tradition, our culture, that are culturally informed, and our practice-based evidences, so that we look at our strengths from our own communities. So we have several resources online, and I'd be happy to send you some of those that are focused on being culturally informed and culturally responsive, because that's what needs to happen. A lot of people say, well, I'm culturally competent. I've read about the Navajo. I've read about the Inupiaq. I've read about, it's great to read about all these different communities, but that doesn't mean you are culturally informed or that you are culturally responsive. Even as a native, I shared with Michael at the beginning of our call today, I was spending time up there in Alaska with several villages in the Nome area. And I learned a whole bunch of great information about the different tribal villages, that not all Alaskans are the same. You look at Alaska in itself, there's over 200 villages there in that one state alone. I don't know the exact number, but I know it's over 200, just like the tribes across the lower 48. There are over 400 of us that are either federally or state recognized. And so it's really important to say that we're not a one size fits all. We're very unique in our language and our culture and our tradition. There are some similarities to our stories, to our history, but we can learn from each other of how to work with our communities and look at things from that cultural lens, Michael. So I want to say thank you for bringing that up, and I'd be happy to share a couple of resources for that. I just gave a talk in Green Bay, Wisconsin, at the Great Lakes Intertribal Conference about 2 weeks ago. And it was on that very topic of prevention from a Native perspective.
Thank you. Yeah, and as you know, as I think probably as well as the rest of us, that there's a lot of us doing things that are effective. It's just that our grants are so small and they take up so much money to do that programs, much less there's not much time or money left to spend documenting, especially, with the research that's needed to make it a quote proven practice. So, even if you could keep your eyes out, watch out for funding that specifically set aside to help programs become documented as effective, that would be really helpful, because that's almost a separate effort. In addition to doing a program, is documenting that it's effective. Anyway, just another thing that I see, because there's a number of things that have been done, But if you don't have the money and the staff and the expertise to document that it's professionally done and effectively proven, it doesn't get listed or acknowledged.
Mm-hmm. Yes, we have this wonderful researcher and educator at OU, Dr. Dolores Bigfoot. She's done a lot of work in the field of trauma and the impact with children. And she noted a term called promising practices that SAMHSA has officially said, this is a term that we could share and demonstrate that there are some validity of these ways that we honor our tradition, honor our culture. I don't know if it was Gemasina or April, one of you talked about drumming. Gemasina was talking about it. Several people who've been on these calls with us the last several months have talked about the talking circles, drumming circles, teaching our young people how to make regalia, all of these important aspects of our identification and the ways that we can help our young people stay connected is really important. So thank you all for sharing these important ways of reminding us to stay connected. Are there any other ideas or suggestions that would like to be shared at this time? I'm going to pull up one more slide of things that we've been asked to share at the center. And I'm hoping that you've heard of some of them, but we're going to be offering them with native adaptations because we believe it's important to the communities that we serve. And if you can see my screen, and most of us have heard of SAPS, Substance Abuse Prevention Skills Training, at the end of the screen here. And many prevention specialists are trained in this curriculum. It is important, it is valid, it is evidence-based, but it's not Native specific. And so we had Dave Braveheart, a former colleague of ours in the field from the Minnesota area. I can't remember what tribal community he was with, but he took the time with a team to adapt the curriculum that SAMHSA asked us to implement across the country for prevention specialists. And he did it from a Native perspective for our communities. Recently, within the last 3 months or so, SAMHSA has updated the SAPS program and asked us, the center that I work for at the University of Iowa, the Native Center for Behavioral Health, to keep it with a Native perspective. And they've given us permission to make those adaptations again for the updated version, so that it is specific to our communities. Some core competencies. This came out last fall. It's a new curricula that's being offered in some regions. They are testing it. Someone talked about pilot testing some programs. Well, a lot of regions are pilot testing this curriculum. It is good. It is important. But when I took the training for the first time myself, I saw a lot of issues with it and how it did not speak to our culture at all. In fact, I found some areas to be inappropriate. And I shared that with the SAMHSA staff, who did receive it well. They came back to us this spring and spoke with our director and myself, and they have given us the task, because it has not been indigenized at all. They have asked us to make a Native perspective of this point of view, to put the Native cultural lens in this documentation. So we're working on that right now, and our goal is to propose that we pilot that this fall. And the last one is in the center of the screen. Moderated ethics is another one that's been around for a long time for prevention specialists to take either moderated ethics or advanced ethics so that we can be prepared to serve in this field. Again, it's not an indigenized document or curriculum. And so I have one of our prevention fellows who is Native and serves tribal communities, is working with our team to create that for our Native people. And so these 3 curricula are very informative, very appropriate, have great information that support the field of prevention science. But it's been tasked to our center to indigenize them, make them Native, and not just to slap a picture on there and say, okay, here's a Native document. We intend to do something much more than that with these documents. And so I want to invite you just to be on the lookout for those with our center. The goal would be late fall, probably in October, we'll start promoting these so that we can offer them to tribal communities so that people who want to be certified as a SAPS trainer, perhaps, or moderated ethics trainer, or even a prevention core competencies trainer. Once you've gone through the Native component, that you would be able to offer that through your own communities, no matter where you're serving. But we want to make sure that we're providing the best opportunities for our Native communities to learn from Native experts in the field. So I want to invite you just to be open to that. Be on the lookout for that. Are there any questions about any of those? Trying to put all 3 of them here on the screen. Oops, if I can remember. And the moderated ethics, just so you are aware, is offered very often asynchronously, which means self-paced on the computer all the time through a software program called Healthy Knowledge. Usually every 2 weeks, it's being offered on that platform. It is not Native specific at all. And so that's one of the reasons why one of our fellows here at our center, who's serving in the field of prevention science with Native communities, is working on that specifically. So these are the 3 curricula that we'll be offering in the fall that are specific to Native communities. They are all being offered across the country right now from a Western perspective. And when we have those dates available, I'll be happy to share them with you. And they're all offered at no cost. So the biggest thing is your time, because SAPS is a 4-day training. The moderated ethics, we're going to try and do a 2-week program of sorts with a hybrid, with some curriculum will be online. So it's kind of self-paced in that regard, but then we would have some face-to-face Zoom meetings, probably at least 2, 1 each week. And you would have a certification in that. And then the last one would be the prevention core competencies. And the reason why we are promoting these through our center is for those who want to take the IC and RC exam for prevention specialist to be certified. It is required that you have these 3 curricula under your belt, if you will. And this is a simple way for folks in different states to all go through the preparation for the IC and RC. And I'm going to put a little blurb about this, or share my screen rather, so that you can understand what I'm talking about. It is very important to not just our center, but across the country, for those of us who serve in the field of prevention science, to come from it with a professional perspective. We are trying to professionalize this line of work. So the International Certification Reciprocity Consortium, IC and RC, are offering opportunities for folks, and this has been around for a while, it's not new, to actually take an exam to become a certified prevention specialist. It's not required, but it professionalizes the work that we do. And we are supporting that from a Native perspective. So for those of you who want to pursue this, it is individualized. The exam is individualized state by state. So you would need to contact the state authorities, and we can help you with that. Our center is willing to help you with that. I know there's a small fee to sit for the exam. We want to help you be successful with that. Right now, we are working with training our 3 Native prevention fellows in this field so that they can be prepared to sit for their exam and become certified prevention specialists in their own communities. And we're happy to announce that we'll be offering these trainings in the fall. Any comments or questions about them? Okay, I'm going to share one last screen as we move forward and close out our time together. As I shared with you at the top of the hour, we're going to offer one more session in August. And I have the date here for you. I don't have the registration link yet, but I will be emailing this out. But if you want to put it on your calendars in advance, August 22nd, which is another Tuesday, I believe, at 12 noon Central Time. So you can adjust your calendars and your schedules if you're able to join us. It'll be the last platform similar to what we've been doing for this year. Moving forward, beginning in the fall, we're going to be changing it up a little bit. We haven't decided exactly what we're going to do yet, but we are open to suggestions and ideas for how we can continue to support the work that you're doing. It's PFS grantees. Those of you who are on the call today all mentioned that you are still in the midst of your grant years awarded. So it's really good news that we continue to work with you all in this field, whether it's providing technical assistance by way of a virtual session like this, or actually showing up in person to provide a training. I shared with Michael at the beginning of our time together. We have somebody up there in his area who invited us to actually provide a prevention training in person. And so we're talking to them about what that would look like for us to travel up there at no expense to your community, that we will bring our team and provide a prevention training for you all as needed. So that is one way that we can help. So just what you might need coming up this next year, looking at your plans, looking at the work that you already have documented on your calendar for this year, if there's some way that we can support that. Gemasina, the documents that I'm going to provide for you for Red Ribbon Week, for example, were a technical assistance request. Somebody said, we need Red Ribbon Week materials. So our team created Native specific Red Ribbon Week materials and sent them off to her at no charge. So these are the kinds of things we want to continue to offer and support you with. And we would love to partner with you in your communities and support your work in the field of prevention. I want to say thank you to those of you who joined today. And I want to wish you all a good day, good afternoon, good rest of your week. And please let us know if there's anything else we can do to support you all in your field.
Thank you.
Thank you, Allison.
You're welcome. Have a good afternoon, everybody.